All right, one more time, the program still here this morning on ITV. So privileged to have a mighty guest here today, talking about Professor Bazwaye Godwin Nusakai, who is the CMD of Igbinedion University Teaching Hospital, Okada, and where there is a center in Benin City. And of course, Professor Godwin Nusakai Bazwaye is also a professor of hematology and a stem cell transplantologist. He pioneered the very first stem transplant for the cure of sickle cell disease in sub-Saharan Africa. And of course, we are told that just recently he successfully performed a bone marrow transplant for the cure of cancer in Benin State. So welcome to this program this morning on ITV.
Thank you very much.
Yeah,
nice to be here again.
We keep on hearing of the stem cell transplant, the stem cell and all that. What exactly do we mean by stem cell transplant?
Well, stem cells are special cells. Well, we can actually call them mother hen, you know. Initially, they were called bone marrow stem cells. But now, because stem cells can be gotten from so many places, so the name now is stem cell transplantation.
Okay.
So what we do is to take a mother hen from the bone marrow, which is a stem cell, and you can use to cure so many diseases. You know, if you take a stem cell of somebody whose genotype is AA, and then we destroy that of the sickle cell, and then transplant that cell into the patient who is SS, the patient automatically becomes AA. So if we take the stem cells of somebody who is SS, of AS, yeah, the person becomes AS. So the stem cell is what produces a group of cells and produces itself. So it's like a mother hen that produces hens and also produces itself. So it regenerates. So that's the power of the stem cell. So with that, you can do so many things, including the cure for blood cancer, including the cure for things like multiple myeloma, and then even for bone marrow failure. So the use of stem cell is enormous. It's just one part we're actually doing now. The other part, which we call regenerative medicine, where we can use stem cells to grow hair, we can use stem cells to regenerate skin, we can use stem cells to regenerate spinal nerves. So stem cell is what we call a magic stem cell that you can use to do so many things. Okay.
Now, this is not what brought you, but yes, I'll quickly just ask. Now, this stem cell transplant we keep on talking about, keep on hearing, does it have any age specifics? Is it age specific or gender specific?
No, well, yes, some of the diseases have some age limitations.
Okay.
Like transplant for sickle cell is better done when you are, I know the patients, they are kids, I mean, below the age of 18 for sickle cell. Better that time, way. But that was what it was several years ago. Until recently, we can now do stem cell transplant for sickle cell patients even up to the age of 45. So, you see, age limits has some part to play. Okay. Then for things like blood cancers, if somebody is above maybe 60, it becomes a little difficult to be able to do stem cell transplant. So the older the patient is, the less chances of being able to use stem cells to cure the patient, because the procedure is rigorous. And then you need a good organ function, you need a good kidney, you need a good liver to be able to metabolize the drugs.
For the success of it.
Yes, so that's why the older you are, the less chances that you'll be able to benefit from stem cell transplantation.
Okay. Now, we understand that the Igbinedion University Teaching Hospital is going to be having 1 week free clinic in Benin from Monday to Saturday, 13th of March, 2021. And of course, we're told that this is in line with the philanthropic spirit of the Esama of Benin, His Excellency Chief Dr. Gabriel Osawa Igbinedion. Now, you want to tell us about this 1 week program?
Yes, thank you very much. You recall too that the owner of Igbinedion University Teaching Hospital, the Esama of Benin, is in his nature of being a philanthropist, especially in the health sector now. A philanthropist in so many other aspects, but we'll just concentrate on the health sector. So the Esama was visited about some weeks ago by the Edo State Committee on Edo Insurance. You know, the governor is trying to set up an insurance policy for the underprivileged. And then so the Esama is fully in support of such activities, and he is giving his blessings. And in his philanthropic nature, he feels that we should be able to also do some free programs. There are others we always do, but usually we want to do that for the Edo people. And so from on the 8th, which is a Monday next week, to Saturday, the hospital will be rolling out free medical care for Edo people who are not able to afford medical care. Those who are pregnant and they're about to deliver, they can't afford delivery fee, they can actually come there. For basic surgeries like appendectomy, herniorrhaphy, I mean the basic surgeries, those who have been having such problems and they cannot afford it, they can actually also use the opportunity. Malaria, basic illnesses, and also I will be there to see sickle cell disease patients. So all sickle cell disease patients who are in Edo State who cannot afford the fee of seeing a professor will use the opportunity to come to the Benin University Teaching Hospital, Benin City.
Are you going to be doing some free transplant?
No. That's why I said basic surgery.
Yeah.
Stem cell transplant takes about 2 to 3 months to do the transplant.
Okay.
And it's an intensive care program. So we will not be able to do things like that. But I mean, counseling, treating basic illness in sickle cell disease patients, and also doing other basic things to ensure that the sickle cell disease patients live a better life.
Okay. Now, from what time of the day? Because the program runs between 8 and 13th of the month.
Yeah.
Now, from what time of the day are we looking at?
Yeah, we're looking at starting from 8 o'clock
in the morning.
In the morning till 5 p.m.
Okay.
So when you come in, and we also want to use the opportunity to take care of those who need some admissions and they cannot afford to be admitted in big, very expensive hospitals. We will admit them for those periods. When the situation is very bad, I mean requires a more high medical care, we may need to refer some of these patients. But we will run the clinics from 8 o'clock in the morning till 5 p.m. every day, from Monday to Saturday. And then we also feel too that if some cases need to be referred to UBTH or other centers to follow up, the team of doctors will do that. So we'll have experts both in medicine, surgery, obs and gynae, pediatrics, all aspects of medicine, including ophthalmic care, dental care. So all the professors in IUTH will be on ground.
On the ground.
Yeah.
Now, you said minor surgery. Little wonder if we have anything like minor surgery.
Yes.
I benefited from the SMR of Benin. That was about 6 years ago. I had a pterygium on my left eye, a growth.
Yes.
You know, such a program like this. And of course, I took advantage of it. And I was operated on, my left eye was operated on, and it was highly successful. Now, the point I'm trying to make here is that you find that some people, they've heard it, they are watching this program now, and they've heard it that ASAMA is doing another free medical care and all that. They come with all manner of ailments and all that. So how are we going to look at that?
Yes, that's why I mentioned the issue of referral. Now, let me give you an example. You asked the question whether I will be doing stem cell transplant. So we won't be able to do stem cell transplant.
No, you talked about it, so
yes,
that's why I had
that's
to
what I'm saying. So I'm just giving you an example.
Okay.
Also, to things like somebody comes in there, has a heart problem, requires some heart surgery, for example, we will not be able to do that.
Okay.
Somebody requires to do amputation, things like that, we will not be able to do that. But pterygium operation is also a minor ophthalmic procedure. We will not be able to do things like retina repairs and you know, things like that. I'm talking about, so when you come in, whichever illness you come in with, we will decide whether it's what we can do there. If it's beyond what we can do immediately, we will need to refer you either to the teaching hospital in Okada, where such facilities are available, the machines and expertise, or we'll refer you to another teaching hospital where you can get such.
All right, so this free medical care treatment, we have a center and annex in Benin City of the IUTH, Benin Medical Center in Benin City.
Yeah.
So where exactly is going to be the location of this one?
Okay, now the former IUTH annex used to be an annex, a small building opposite Market Square.
Along Sapele Road?
Yes, along Sapele Road. So that is currently being renovated to become IUTH Diagnostic Center. So we're hoping that we'll be able to commission that before the end of this month, where we'll have a full gamut of diagnostic facilities. But the current Benin University Teaching Hospital Benin Center has actually moved to the 5-floor glass house opposite the former Coca-Cola building. So it's just by the side of yes, on Sapele Road, by the side of Market Square, but opposite the former Coca-Cola depot building along Sapele Road. So it's just within the same vicinity there. So that glass house is a 5-story building, and that's the current IUTH Benin Center. So that's where the program will be taking place. Okay. From Monday to Saturday.
A lot of people, when they hear Igbinedion Teaching Hospital, their mind goes to Okada. Yes. So let's say I'm coming from Ogbese and I stop at Okada, will I be attended to?
Well, I think for now we are currently concentrating on the Benin axis.
Okay.
Yes, and I'm sure before the end of this month we plan to do another program in Okada. So to cover for, because if you're going to come for just malaria and you want to take a transport from Ogbese to Benin,
yeah.
it will be not economical. So we're hoping that the program will be replicated in Okada for those who are in the environment of Okada. So for now, this is in Benin City, and it's taking place in Saple Road.
All right, thank you so much, Doctor, for finding time to join us on this program today.
Thank you very much.
Yeah, Dr. Bazwaye Godwin Osahai, who is the Chief Medical Director of Igbinedion University Teaching Hospital in Okada, that has a branch in Benin City. Talking about the free clinic, the free medical treatment that the SMA is going to be doing between Monday 8th of March to Saturday 13th March 2021. Thank you so much for coming. Thank you so much.
Thank you very much.
All right, other segments now on the program. Thank you.